Let's talk about what my day in family medicine looked like today, shall we? I had 16 patients, which felt like a very manageable amount. It's been a lot more than that lately, so I was very grateful. It was kind of a weird day in that I had 12 well childs and then 4 adult physicals. There were no sick visits and there were no like follow-ups. The follow-ups were kind of just like melded into these other visits, which is always an adventure. Topics we talked about today were speech delays in toddlers. This is all with like the kid stuff. Gross motor delay discussion. Talked about some behavioral parenting, different just like big feelings in small people, coping strategies, how to navigate that. I had a newborn visit for a 5-day-old. It was for a 5th child in the family. So those are such a breeze by that point. 5th child, everything's great. Dyslexia, possible ADHD, quite a lot of mild asthma management, and followed up on a lot of like sick visits that I had seen within the last 2 weeks. So this was kind of, they were already here, so we were following up on that. An ingrown toenail, difficulty sleeping, being very, very picky with food. Weird generalized symptoms that we're going to work up for, like anemia and make sure everything's fine there. Adult-wise, I had some discussions about anxiety, depression management. I had someone who is currently pregnant. A lot of things you can be like, oh, it's just because you're pregnant, but you want to make sure that it's not just because they're pregnant. And they didn't feel like their provider who was providing prenatal care for them was really listening to them about that. So we're going to dig into a few things. Started someone on hormone replacement therapy for menopause, changed someone else's oral birth control because they were going to try a different kind of progesterone that will hopefully help target some of their symptoms like acne, a new finding of high blood pressure. Again, talking about what that is, why we care, what we can do to help lower it, and some wrist pain. That seems like it's probably carpal tunnel. So we're going to do some bracing on it. So it was a whole smattering. Should have just been preventative visits, but we know how that goes. I also had 11 patient messages. I got back to 9 of them. I have a couple hundred labs to go through. I filled out a couple forms. There's a lot more left. I sent a bunch of refills. I did not get all of the extras done and I did not finish, but I did my best. And now I'm going to go home. All right. Have a great day. Bye.